In Paris, hearing aids may soon be available over the counter. Last week, the FDA issued a proposal to allow hearing aids to be sold directly to consumers without a medical exam or fitting by an audiologist. This comes after Congress passed legislation in 2017 requiring the FDA to create an over the counter category. The agency says some 37 million American adults have difficulty hearing, but only 1 in 5 people who need hearing aids actually have them. One barrier is the cost. Some say this legislation could lower that financial burden. Joining us to talk about the proposal and what it could mean for people with mild to moderate hearing loss are Barbara Kelly, Executive Director of the Hearing Loss Association of America, a consumer group which has a chapter in Chicago, and Mike Sharp, an audiologist and the Vice President of Audiological Affairs at the Illinois Speech Language Hearing Association. Thanks to you both for joining us. So first, Mike, if you would, please explain the proposal and what it could mean for people with hearing loss.
So the proposal is currently from the FDA in a 90-day comment period for organizations and consumers to comment on. Right now, we don't have a deadline as far as when that'll be out for consumers, but what it should do is create a category of hearing devices that will be available over the counter for patients to be able to access. What's really nice about that is for the right consumer, they could be a very good option for someone who maybe has potential pricing issues, or maybe even has some sort of, maybe doesn't want to enter the hearing aid market at the current time, that sort of thing. So there's lots of other options for patients, is hopefully what it'll create.
And Barbara Kelly, what's your reaction to this proposal from the FDA? This, of course, comes, as we mentioned, after the 2017 legislation that pushed for over-the-counter hearing aids.
Well, we've been waiting for the proposed rules, and we're very excited about it. These are just for adults with mild to moderate hearing loss. And we know that when someone finds out they have a hearing loss, they wait 5 to 10 years before they do anything about it. And that's just way too long to go without those human connections. And there's some comorbidities associated with hearing loss. So if this gets a person to take that first step sooner rather than later, when hearing health appears to be a little more mainstream, that's a good thing.
And briefly, Barbara, you mentioned comorbidities related to hearing loss. What are a couple of those?
Yes, well, untreated hearing loss is associated with falls, and that's the number one thing that takes older people to the emergency room. Isolation, because you're cut off from human connections, and it's just too hard to go out in groups and not be able to hear, or family gatherings. And so people tend to isolate, which could lead to anxiety and depression. And there's research being done on the cognitive link between untreated hearing loss and cognitive decline. So hearing health is very much a part of overall health, as is everything else, our blood pressure, cholesterol levels, everything.
And Mike Sharp, who are we talking about here? Because I think there's this misconception, obviously, that it's just older adults impacted by this, but it's actually more prevalent.
Much more prevalent. There's a lot more younger adults who may have long-term noise exposure because of their job. They may have had recreational noise exposure, or some people for genetic factors just are more susceptible to hearing loss earlier on in life. We see patients all the time in my clinics that are in their 40s and 50s that may have mild hearing loss. Maybe they're not ready to take the jump for a traditional hearing aid fitting at that point. So there's something like an OTC may be a better fit for them. The couple of things to be careful of are there are certain types of hearing loss that are caused by medical conditions. So an evaluation from an audiologist is always the most beneficial, but it's always not the most realistic in every situation. So an over-the-counter hearing test could potentially, like I said, be beneficial for people who maybe don't feel like they have the type of problem that warrants a traditional hearing aid fitting.
And Barbara, how expensive can hearing aids get, and how might over-the-counter aids help mitigate that?
Well, hearing aid cost runs the gamut. I mean, there are top of the line hearing aids that have artificial intelligence that monitor your blood pressure and when you fall. And then, they can run down to $2,000 a pair. So instead of talking thousands, would be talking hundreds. But the important thing to note is that when you get a hearing aid with an audiologist or a hearing aid specialist, you're also paying for those services. And for some people, that's very important. The aftercare, the follow-up, the fitting, the oral rehabilitation. With over-the-counter products, these are going to be totally self-fitting without the help of a professional. So we're talking hundreds as opposed to thousands. And some people just need a little hearing enhancement. People who might be, in their 50s, who might still be in the workplace, aging into their hearing loss, or they've had a lifetime of exposure, who might need a little help in the conference room, at a table, around, with a meeting. So that's why the over-the-counter market opens up a lot of possibilities for people.
And Mike, there are also though devices called personal sound amplification products that are available on the market. Briefly walk us through the difference between those and what could be this new category of over-the-counter hearing aids.
Personal sound amplifiers are devices that aren't regulated by any organization. So they are kind of the wild, wild west, so to speak. So most of them tend to just be amplifiers that can turn everything louder and everything softer. The downside to that is most hearing loss is more complex than that. Most hearing loss happens where, for example, because of aging, people will have good low pitch hearing and significantly more hearing loss in the high pitch range. It causes people to have issues where they say, it's not that I can't hear, it's I have trouble understanding what you're saying. Well, the problem with PSAPs or personal sound amplifiers is they can turn it, once you turn it up loud enough to accommodate for the high pitches, you may actually be way over amplifying other areas of the hearing loss or lack thereof. So an OTC would actually be, even though there's no hearing test from a audiologist or hearing aid specialist, you would be taking a sort of hearing test via usually an app on the phone. I'm assuming we don't have all of those answers yet, but that's the most likely thing, I would assume.
And it sounds like sorry, we're out of time, but it sounds like the OTC hearing aids would be more specific devices compared to the others. That's all we've got time for. But Mike Sharp, Barbara Kelly, thank you so much for joining us.
Thank you.
Thank you.